For my older guys, testosterone already has like this taboo or biased meaning for them. They feel like they are going to have issues with anger or be this completely polar opposite person from what they currently are. And honestly, testosterone just kind of magnifies your qualities you already have. It helps out keep you more cool, calm, collected. You can handle stress better. You have more energy to deal with a lot of the different things going on in your life. As far as other health concerns, in the last 20 years, they've been debunking most of those. As far as prostate cancer goes, as far as like cardiovascular concerns, those are all things that they've actually just recently updated on the FDA warning label as well, saying that those are not as big of concerns for testosterone users. I get a lot of guys that come in saying that their primary care doctor or whomever is saying that their levels are normal for their age, or how they're acting and feeling is normal for their age. That does not have to be your new norm. Tired, low libido, not wanting to get up in the mornings, difficulty dealing with stress, that does not have to be your new normal. That is based on the preconceived notion that as you age, you're just going to completely deteriorate, and that doesn't have to be the case. When someone comes in or someone is starting to notice symptoms of fatigue or loss of joy in like their normal daily life, or they're being like really irritable, low libido, there's so many things that it can be, but testosterone is one of the first things that I test for. But there's a multitude of other things that it could possibly have to do with. The thing that I hear the most is, especially with my guys 55 plus, is that they're like, I'm aging, I'm falling apart, that's just part of life. That doesn't have to be. We can get you to come in, we can run a full panel of labs, and you may or may not need testosterone, but there's other things that we can optimize as well. Every plan is personalized for you and what's going on. And once again, falling apart doesn't have to be a part of the plan. Your future health is now. Don't wait until retirement. Don't wait until you're completely falling apart. Then you're already like behind. You need to prioritize yourself. I've got so many guys that are like, I'll look at doing that once I'm retired or once I have more time. You can't get time back. So you need to come in, look at your health for now. And at least just know your baselines, where you're looking at. But falling apart does not have to be part of your aging process, and catching it earlier is the best. And if you're already symptomatic, those symptoms aren't going to just start resolving itself. If you wait until you have the time, you wait until you're retired, your fatigue is going to get worse. Your libido is going to get worse. Your moods are going to get worse. It's not anything that's just going to fix itself just by waiting around. And as the years go on, your testosterone, other hormones are going to continue to decline as time goes on. So if you think you're feeling bad here and you wait 5 more years, you're going to keep declining down to that too. When it comes to health, this is not something that you can just bank on. You have to be actively pursuing that, actively pursuing the betterment of your life and your lifestyle if you want to age gracefully or age well. I have so many patients that tell me they're just trying to time it right. Or when I start talking to people about being on testosterone or improving their health, they're like, yeah, when I find time or when the time's right. The time is now. You're only going to either improve from where you're at, or you can then start declining. I have patients that tell me all the time that they're healthy enough, or they don't think that this is the right time to really pursue their health. Something to think about. We can start now and improving, or your starting point could be already at the decline, and that's just further up the mountain that we have to go to get you to feel your best. The other big hurdle I have with a lot of my patients is going to be that they think that this is something they can overcome, that low testosterone is just a phase and I'm going to overcome it. You can't fight against biology. At some point, you are going to have to accept that you need help, and that's where I step in. We come up with a plan for you. We personalize everything, your plan, your dosing, to what you are needing at that point in time. And that's also something that will adjust as we move forward. Coming in for a consult or coming in just to talk about what's going on is not admitting defeat. It is the first step. Everything is getting more geared towards preventative medicine and trying to feel your best for the longest. And once again, that consult is that first step to see where you're at and where we can go from there. Something I tell a lot of my patients or prospective patients would be, think of the future that you want. Look at, are you down on the ground playing with the grandkids? Or are you sitting up in the chair watching TV with them? Like, what, are you having an active role in their lives, or are you more the sedentary? Or think back to your grandparents. If you are wanting to be that active grandparent, be there for your family, be there for your kids, your wife. One of the first steps is proactively thinking about your health and thinking about your longevity. The other way of looking at it is, how do you want to live your life? Do you want more quality and quantity? Because that is something that longevity, preventive medicine, potentially testosterone could give you. And once again, that first step is just coming in for a consult. Let's just take a look at everything and kind of see where you're at, and we can go from there. Usually one of the deciding factors for one of my patients when they decide to actually start some sort of therapy, usually testosterone therapy, is because they don't feel like themselves, or they've heard complaints from their family members that they're not present enough. They have a short temper. They're a lot more irritable. They don't have the energy to go do the things that they want to do. And that's usually, from an outsider looking in, they're kind of like, oh, wow, I don't want to be that person. I want to be a better person. I want to be present. I don't want to just be a sideline grandparent or parent in my life anymore. The other thing that guys come in for is they'll tell me, I'm going to the gym, but I can only go twice a week because it takes me 3 to 4 days to recover. Playing a round of golf just knocks you on your ass for a few days, like when it didn't used to. Same thing if you got the grandkids that came in for the weekend, and where you used to be able to play with them all weekend long, you're almost excited to see them go. That doesn't have to be part of the aging process. That is something that the testosterone could help, or just, once again, knowing your baseline and getting you optimized. Some of the symptoms for low testosterone aren't like slap you in the face symptoms. They are things like, just being a little bit more worn down by the end of the day, or in the gym, you're not recovering as well, or you're in the gym and you're not seeing the muscle growth that you used to see, or you're not able to lift the weights that you used to be able to lift. Those are all kind of just things that men just take as aging, which as you age, your testosterone does start dropping, but that is something that we can also improve on and help too. And sometimes people with these vague symptoms, people will sometimes be like, oh, I can push through it, or oh, this is just, I'm really stressed, or oh, I'm really run down, I've got a lot going on. And they don't know when is the right time to actually start coming in and looking at what these symptoms are and what they're doing to their overall health. I tell people, whenever it's starting to affect your daily life, like if you wake up in the morning and you're just exhausted and you don't want to get out of bed, or if you finish your day of work and you can't come home and help around the house, or if it's getting in the way of your hobbies, basketball, golf, whatever sport it is that you enjoy doing, and you're not able to do that anymore, if it's affecting what's going on in your life, then I think it's time for you to start getting something looked at. My main goal when it comes to treating my men is not to get you feeling like you're 16, 18 again. It is to improve your daily life to where you feel like you don't have to have a weekend to recover from your weekend. If you feel like you're struggling with any of these things, fatigue, low libido, not feeling like yourself, getting more run down than you used to do, the first step is coming and getting that looked at. We'll run your labs, we run a full panel, go through your medical history, go through your lifestyle, and kind of really hone in and get a plan for you to make you feel your best.